Someone just asked me, how important are balanced hormones for your health? I would say critical, absolutely critical, because the hormones are kind of the foundation for your system. They help you cope with stress. They they provide a foundation for your neurotransmitter balance in your brain, and absolutely have been the fundamental kind of part of my medical practice for 25 years is balancing someone's hormones, because I always look at that as like a great first step. It can kind of like help them feel a little bit better right away, clear out some of the background noise, and provide a platform to work from as we are moving deeper into restoring their health by treating infections or detoxing them of some sort of toxin like heavy metals or whatever. So balanced hormones are critical for both men and women, equally critical. And so just when I look at hormones, I look at the whole milieu for the most part. So I really like to look at, in terms of peripheral hormones, the thyroid, the adrenal hormones, and the sex steroids all together. And they interact with one another in so many important ways. So it's really about balance and a balanced milieu. And when you pay attention to the balance of everything, you don't need to use as much of any one hormone. I think one of my faults I see out there in the world with other doctors and how they approach patients' hormones, is that they tend to kind of focus like on one hormone or two hormones, and then they're very heavy-handed with that. And the hormone milieu in the body is incredibly nuanced and delicate, and you can throw it off very easily. So you have to be careful and be subtle with how you approach it. So anyway, I gotta say that the adrenals is a really important starting place. If they're depleted, you've got to work on those first, because that allows you to tolerate adding in some thyroid if someone's deficient in thyroid, for example, because the adrenal hormones help you cope with stress. And even though thyroid's necessary for the body, it's a stimulant. And so in certain ways, it's stressful. So you need to have like a solid kind of adrenal foundation in order to take thyroid properly. And the adrenal hormones very much influence the balance of the sex steroids. So, for example, the adrenal cortex makes not only cortisol, but DHEA, pregnenolone, a portion of your testosterone. And so, if you're starting there and you're dealing with the adrenals, you're augmenting the natural production of the downstream hormones like estradiol and testosterone. And so then if you did need to supplement those, you wouldn't need to supplement as much. There's also the situation in females where if you don't have strong adrenals, the body's going to rob progesterone in order to make cortisol. So an adrenal deficiency can throw the balance of estrogen and progesterone off in a female. So there's just a lot to think about. But seeing someone who can take a look at the entire picture is mandatory, because that's where you're going to feel the best if you kind of balance everything together.